recording. Namaste everyone. On this okay, so let us start. On this auspicious day of Guru Purnima, as Sir told, after such a long gap of our request, he has joined today. I feel it is destiny that we wanted the Guru's blessing on this day. So it's not, we are not blaming anybody, and we feel that it is our blessings that you are here with us today, sir, on this auspicious day. There is a dohe by Saint Kabir where he says, Guru Govindo khade kake lagu pai, balihari Guru apne Govindiyo hotai. When both Guru and Govind, we encounter them, to reach Govind, we need Guru. Because a Guru can make a big difference in our life by he takes our hand, he opens our mind, he molds our behavior, and he touches our heart. So on this auspicious day, I welcome all of you for our 49th webinar, which we usually conduct from RAAUOS organization. I wholeheartedly welcome all of you. Tvameva mata cha pita tvameva, tvameva bandhuscha sakha tvameva, tvameva vidya dravinam tvameva, tvameva devam sarvam mama deva deva. Unless we start with a prayer, it feels very incomplete. Because for all our endeavors and even for the success of today's webinar, we need his blessings. So I now request Dr. Datta sir to offer his prayers.
Namaste all. Guru Brahma, Guru Vishnu, Guru Devo Maheshwaraha, Guru Sakshat Parabrahma, Tasmai Shri Guruve Namaha. Shruti Smriti Puranam, Alayam Karunalayam, Namami Bhagat Padam Shankaram, Loka Shankaram. Namami Dhanvantarim. Yo Vishwam Vidadati Pati Satatam Samhara Yetyanjasam Sruštva Divya Mahaushadisham Vividan Duri Karotyamayan Vibranonjali Nachakasti Bhuvane Piyusha Purnam Gatam Tam Dhanvantarim Adideva Mamalam Vandamahe Shreyase. Thank you very much.
Thank you, Datta sir. It is told that we can achieve impossible things through prayer. Maybe our prayer reached Dhanvantari, so sir is with us today. So now, because of RAAUOS organization, we are here today. So now I request Dr. Shakuntala Patil Madam, who is founder of this organization, to introduce this organization to all of us.
Thank you, ma'am. Archana ma'am. Namaste all. Today on this auspicious day of Guru Purnima, I wholeheartedly welcome Bendale sir to our RAAUOS webinar. Thank you so much, sir. Welcome, sir. And I wholeheartedly welcome all Vaidyas who have joined in big number today, because within 15 minutes of starting our session, we got more than 100. So this shows that so eager to learn from sir. Sir is so famous with sir knowledge and giving nature. So I really thank you, all of you, for joining on time. Without wasting much time, I want to introduce our RAAUOS team. RAAUOS is Rudra Arbuda, Ayurveda approach under one shelter. So as name suggests, the RAAUOS organization or trust has started in the year of 2019, November 21st, with the intention of to make one circle or make one chain in between all Vaidyas who are actually practicing oncology in our Vaidya. Who are practicing oncology, Ayurveda oncology. So because when I gone through the many Vaidyas, I saw many Ayurveda Vaidyas are practicing oncology, but there is no link in between all of them, or there is no connection with us. Like, we don't know many legends who are practicing Ayurveda, they don't have the connection in between. So to make this knowledge available to all Vaidyas and make this communication to all Vaidyas. We have started in the month of 2019. And in the year of 2019, now the group has totally 938 above, if I'm not wrong, from the 18 states. This is the statistics from our RAAUOS team. And last year we have done the trust also. And to become this much popular, or to say this much work is going from RAAUOS team, is just because of admin's team. I really thank all of them first before introducing my what we are doing, because they are the main pillars who are taking all these works. Because I don't know technical work, I don't know many works, but they are carrying all these RAAOS Arbuda related works as if they are doing for a society, like they are doing for social cause only. Because many Vaidyas who are in admin teams are 80% of our from women. So we know women how they are doing, like what responsibility we are having. Apart from that, they are doing in night 2 o'clock also. I give the call, they will pick up and they will do in the morning. Just within 3 hours they will complete all the work. This is the thing. And I thank all those gurus who are in admin's team and who are in RAAOS team. I really thank you, all of them. This is first word. So RAAOS, what we are, in brief, just I will go. I don't want to waste the time. RAAOS, we are in the RAAOS webinars we are conducting. So every month we are conducting one webinar. Expert will come and share their knowledge. This is the thing where we are getting communication with all the experts. And second is that we are conducting every week 2 classes. One class on Monday, which is especially on yoga. So we refer from Rasa Yoga, Rasatantra Sara, Vasiddha Prayoga Sangra. We take one yoga and we discuss for 2 to 3 months on that. If this Swarna Sutta Shekara. So the discussion will going on. One Dr. Savitri is leading that, and Archana Madam and Dr. Tandle, Akshay Tandle is reading the books. And many Vaidyas are joining and they are sharing their experiences and they are asking the questions. Though this is actually building our knowledge to next level. And with the question answer session is wonderful. And on Thursday class, especially on oncology. So we take one cancer. Now breast cancer is going on. So we discuss on that. What we can, from we will start with allopathy knowledge. And after that, we will jump into directly to our Ayurveda references and what we are doing. So, and others are sharing their expenses. This is 2 classes what we are doing. And we are preparing our own medicine with our Rasashala, Rasashala. And we are... yeah, we will, you can share, I will share lastly, Doctor. So, we are doing Rasashala and Bangalore unit, 2 units we are doing, and Hyderabad with the blessings from Surendra Sharma sir and Koti Nagarjun sir, we are started our Rasashala here. And with their guidance, we are doing many preparations. Now it has crossed more than 30 to 35 actually. I mean, Basmas also we are doing in our small setup. And we are conducting educational trip. Last month we went to Pune, so where we met Bendale sir, and that is the biggest opportunity for us to meet sir and to see the sir from pharmacy and see the medicines, how sir is doing, and how the actually we have to take up our science to next level that we have seen in Pune. We met Yogesh Bendale sir, we met Jamdagni sir, and we met many legends in 3 days. And like that, we went to Hyderabad, we went to Nandigram. Next trip is in Gujarat we are planning. So like that, so this is the educational tour we call. And another thing, we conduct awareness programs in schools, school children. We conduct in sanghas where the ladies and other people will come. So we deliver Dinacharya, Rutucharya and Rajaswala Charya. Also we tell them to arrest the cancer at the first level, and we do a screening camp at our clinics and in a large scale also. And anything left? We are doing anything left, please let me know. So some many things we are doing. Just by telling, I leave some of them. Yeah, I'm complete. And thank you so much. And we will once again, I welcome all of you from this wonderful webinar today. And now I'll hand over the session to Dr. Archana ma'am. Thank you.
Yeah, thank you very much, ma'am. Without a founder like you, we wouldn't have any organization where we can have interactions. As Sushruta says, Meda Buddhi Karoganaha, Satata Adhyanam Vadaha, Paratantravalokanehi. That would not happen without an organization like this. Thank you so very much. Because introducing an organization is a successful performance where we need it to introduce an organization, to know more about that organization, and also it helps in smooth transition and a wonderful communication between the audience and the organization, which will help in the overall performance. So you come to know about what we are doing in the organization. So if we don't have audience, there is no webinar. For that, introduction of organization is very, very important. Thank you very much, Shakuntala madam, for that. And now we have a wonderful, legendary speaker today with us on our 49th webinar. We need an introduction of any speaker because it is crucial for setting the tone, and it needs to be done to build the anticipation and establishing speaker's credibility with the audience. For that, now I request Dr. Pushkala madam to introduce Yogesh sir.
Thank you very much, madam. It's an honor to introduce. It's an honor to introduce Dr. Yogesh Bendale sir and Sadgurubhyo Namaha. Namaskaras to all the gurus and Yogesh Bendale sir. It's an honor to introduce you, sir. And sir is a gold medalist in MD Rasashastriya, and he is recognized very well in the field of Ayurveda. He's a rare blend of deep devotion to classical Ayurveda, advanced translational medical acumen, and also a global clinical expertise. His dedication to the science and its service to humanity has earned him his international acclaim. Invited by royals to treat them and royal peers of nations such as UK, UAE, and Saudi Arabia. He was granted an independent medical license to practice Ayurveda in the UAE as early as 2002 to 2003. His international outreach to promote evidence-based Ayurveda is a reminiscent of his positive attitude for the benefits of mankind. A visionary entrepreneur who has founded and actively manages totally 5 healthcare ventures. These include 3 clinics, which has treated over 1.5 lakh patients already. RAAAUOS Ayurveda Clinic for chronic and critical illness, RAAAUOS Clinical Care, an exclusive Ayurvedic Oncology Center, Dyumna Women's Clinic, focusing solely on women's health. Along with that, he owns Ayurveda Rasayani and a GMP certified pharmaceutical company that produces over 300 Ayurvedic products and developed 3 novel compounds, 2 of which show promising result in cancer care and 1 targeting diabetic retinopathy. Sir also is an innovator and researcher, and he has founded Rasayani Biologics and focused on drug discovery using Ayurvedic principles. Prolific academic contributor, Sir has authored 40 publications in peer-reviewed international journals, holds more than 40 patents, and shows his presence in more than 100 global level conferences. Esteemed member of Global Oncology Forums, which include ASCO, ESMO, SIO, AACR, IASLC, and esteemed member of EACR and ARVO, Association of Research in Vision and Ophthalmology. He's an expert member of General Body of Central Council of Research, CCRAS, from Ayush. Former Vice President, former Vice Chairman in Geriatric Oncology Study Group, MASCC, Canada, 2020 to 2024, and nominated Governing Council member, Tilak Ayurveda Mahavidyalaya, and he is the alma mater of the same college. Selected as CRAV Guru under Guru Shishya Parampara program by Rasashastriya Ayurveda Vidyapith, Delhi. And such an honor to introduce such a great person. We are very happy to have you, sir. And over to Dr. Archana, ma'am. Thank you.
Ma'am, next time when sir is there, we'll have to start 5 to 10 minutes early just to know about him. That is what I felt after listening to the introduction. So we are really happy to have you, sir. Before we start with sir's talk, I would like to request Dilip sir to play the CV, the video about sir and his work.
Ma'am, from Rasayu end, they are sharing the video. Sharayu or Amol, will you share the video, sir, CV?
Yes, sure, ma'am. Mr. Amol, who has joined by the name Rasayu Group, will share.
Please, ma'am. Please, yeah. Now you can share.
Amol, there is no volume actually.
Anmol,
Not
unmute
able.
yourself. Anmol, unmute yourself. You'll get the volume.
Amol, unmute yourself. We are not able to hear.
अमूल आप म्यूट है क्या? थोड़ा देखो, म्यूट है तो अनम्यूट करो ना. नहीं है, अभी भी आवाज नहीं है.
Shakuntala madam, it is better to start with sir's presentation. If there is any issue with the CV, we can have it even in at the end of the presentation also we can have, because it's already 3:35, ma'am.
Okay. Sir, will you start the presentation? Because some technical issues going on, I think.
Yes, sure.
Yes, sir.
I
Thank you,
was
sir.
proposing the same to Amol. Let's not waste time on this. I'm just calling because he's the one who is supposed to present. Because I have some technical issue with my iPad where certain slides are not visible as they are. Hence, I have to take help from the clinic. Amol, let's not waste time on CV and those formalities. Just start presenting the CD. आपलं जो PPT ते तुम्ही त्यांना सांगितलं नाहीये किंवा देर इज कम्युनिकेशन गॅप. सो आता पण मग काहीतरी आधी सॉर्ट करायला पाहिजेत या गोष्टी. आता तुम्ही PPT लगेच चालू करा. Is Amol entered in this, ma'am?
Yes, ma'am. Yes, sir. Amol is here, sir. In the name of Rasayu.
Perfect. Okay.
Yes.
Because he is asking for the permission to present.
I think Dilip sir needs to give him the permission.
Oh, really?
Yeah, Dilip
No
sir.
need, madam. It's already given. Access given, madam. No need.
Okay, okay,
You can
okay.
present.
Before sir can present, I request all the delegates who are present here to keep your mics mute throughout the session because it will disturb the speaker and other audience a lot. So please be on mute.
Okay, so till the moment Amol joins and Amol put the PPT online, let me do my Mangala Charan. So namami dharman tarimami devam sura surai vandita pad padmam loke jararu bhayamrutyunasham धातारमीशं विविधौषधीनाम्. So on the auspicious day of Guru Purnima, after doing Naman to Lord Dhanvantari, I equally give my namaskaram or naman to everyone. And it's interesting, as we all know, that such kind of presentations is always a learning for both the sides. And we are going to share today what we have achieved with the help of Rasashastriya. Why there is a need of Rasashastriya? What are the limitations of Aushadhi Chikitsa? What is the history of Ayurveda says? What is the and how the development of Western medicine also has happened? What are different sciences like homeopathic or other systems of medicines in various countries are contributing to respective health care professionals in their countries? And where do we position ourselves as Ayurveda in today's time? So when we entered in Ayurveda after a couple of months, we realized that this is a great science. But soon we realized that even though this is a great science, I think like that. You people who learned Ayurveda think like that. But society is not considering that. Society is driven by multiple other things. And the first, as we all know, the first choice of medicine in our country, come what may, irrespective of any disease, it's acute or chronic or whatever, most of the time, the first choice of therapy is Western medicine. This is a scenario in India. We started our journey in the West in 1997-8. And when we were traveling, since those times till today, in my recent visit to United States, I come across many patients who are giving the first choice of the treatment to Ayurveda. Unlike our own people in our own country. So I always wonder why this is happening. I mean, are they done with their own science? Are they done with Western science? Or they...
Hello.
Yeah.
आवाज येतोय? हॅलो.
हा, आवाज येतोय.
Yes.
प्रेझेंटेशन कोणी पीपीटी ऑन करणार कोण आहे तिकडे?
हो, करतो. निकलना पास कर लूंगी। हेलो,
हाँ,
स्क्रीन दिसते सर?
screen this. You can enlarge the screen. Yes. Is the screen visible, everyone?
Yes, sir, it is visible.
Okay, brilliant. So I always wonder whether the society over there is way more educated, more aware than Indians, or Indians have got their different thought process because of multiple things, including the colonial hangover. So all this, considering this paradox, we decided to take a certain line of thinking, certain strategy in our work, and a little different approach, which is based on our own global experience we have taken. And unless we show some result in the areas where Western medicine is unable to deliver, then only people will look at Ayurveda. And that too, even Rasashastriya. As we all know that Rasashastriya in today's term is a kind of, at times, controversial issue to our own people, because society has nothing to do with Rasashastriya at all. Society doesn't know. Society doesn't care what Rasashastriya is. But our own people do not have confidence in our own science. So it became pertinent, and we have shouldered that responsibility, how to build the confidence in our own Vaidyas, how to establish Ayurveda or Rasasastra as a rational science on global level. And that is what I would like to share a very few glimpses pertinent to cancer in our today's talk. Next, please. So this is a disclaimer we all should know. This is a presentation for educational purpose, for of course, because only for registered Ayurvedic physicians, because we had a strange experience before. That's why this disclaimer has come in. And it is based on the experience, and chronic and critical illnesses terminologies used are at times from the Western medicine, because we communicate in those terms. And all the therapeutic applications are based, even though in Rasashastra, but based on Arsha Granthas and Rasashastra with 25 years of experience. So what is Rasashastra, as we all know? Next, please. Next. Yeah. So we know the famous reference from Rasashastra is that Alpamatropa Aruchera Prasangata Kshipram Arogyadayitvat Aushadibhyo Dhiko Rasa. Aushadibhyo Adhiko Rasaha is the fourth charan, is also very important. So Alpamatra, it's a very tiny dose. If you look at the dose of our medicines which we are using in our clinic, it starts from 4 milligrams, 10 milligrams, 15 milligrams, 20, 30 milligrams, 60 milligrams. And most of our formulations are below 125 milligrams. And what we are using in clinic is also 125 milligrams, which is like 1/8 of 1 gram or 1 gunza. Even I'm talking about the doses we are using of Arogyavardhini also. Yes, Arogyavardhini can give results with 125 milligrams. Anyway, so Aruchera Prasangataha, why there was a need? Because the dose of Aushadhi or Vanaspati Aushadhi or Kashtaushadhi is very high, not able to tolerate
the palatability issues are very high and things of the kind, which made rishis like Nagarjuna forced them to develop something which may work or which can work with the least doses, and that too Kshipram Arogyadaitva. That too must be fast acting. Nobody has time. Today we are in the fastest age, never before. We are in the AI age, we call it as. Everything is so fast, nobody has time. So patients won't be able to wait for the results which will come after 2 weeks, 4 weeks, 2 months, or 3 months, like that. So immediate gratification is has become utmost important in establishing our practices and our science also, because that is how the Western medicine has established themselves. Next, please. The other important issue is the expiry date. The Masadvaya Tatchurnam Hinamidyatmam Apnuyat. We all know these quotes, and the average highest time of expiry is 1 year or maximum 2 years at some kalpanas. But can we produce something which can last longer, which can last years together? And yes, the answer is Rasashastriya can last like that. So as we all know, the mercury is the pillar of Rasashastriya. I don't want to get into the details, but nowadays we all know that mercury pricing has gone up to the sky, never before. For so many years, we used to buy mercury with maybe 2 lakhs of rupees for one particular pack of 34 kgs odd. But then it went up to 2.5, then it went up to 5, then 7.6 or something like that. And then it went up to 11 lakh, and now today's exponentially it has grown the cost to more than 16 lakhs for the same packaging. It is going to be very difficult now onwards how to use mercury, and even unless we establish its efficacy, because of the international pressure, we are going to get the availability of mercury difficult day by day. I don't want to get into the terms of Minamata kind of thing, how it is harming our science, but what they are doing, what they have said, what we can do and what we can say is very important. But a person or any organization won't be useful or won't be enough, in better terms, to deal with this kind of challenge, which is a huge challenge there already for years together in front of Rasashastriya of mercury. But there is a way forward, and soon we are going to communicate with the central government for the same. As we all know that, how do we detoxify mercury? I don't use the word detoxify because nowadays we are getting mercury which is super critically distilled. But Shodhana is the right way what we do, and it is purified in our way, and generally it is used with sulfur. Next, please. So these are the benefits of rasa, and I already mentioned a couple of them in earlier reference. I don't want to dwell because this is fairly a theoretical thing which you must be well known about it, how it reduces the doses and how it increases the potency and so on. So next, please. So this is very, very important, the authentication of the processes. And this is, I think, the key for any science to establish it as a rational science. When we get exposed to Ayurveda, we realize that Ayurveda is Darshan Shastra, Ayurveda is anatomy, physiology, Dravyagun, Rasashastriya, Balrog, and so on. But when you look at the Western medicine, they developed and they are being accepted all over the world for a reason. I completely agree that reductionist approach is not the right approach when it comes to the health, when it comes to the disease, and when it comes to the man. But when it comes to the processing of medicines, I think reductionist approach, only processing I'm talking about. I'm not talking about the things which involves the extraction of active ingredients. That is also because of the reductionist approach. But this reductionist approach has been widely accepted by the Western thinkers. But when it comes to the processing only, I think, in my personal opinion, this reductionist approach is very, very important because our processes are not though that easy how it appears to be. So let's take a simple example. When we make a decoction, even if you follow the same amount of drug in the same amount of water, the same amount of heat supplied, the times of heat supplied, etc., it is easily seen, observed, and even proved that the decoction every time made is different as compared to the others. And the active ingredients or the decoction, how it looks, how it gives its clinical results are actually different. So we think that what it takes to make a decoction, it's not like that. What it takes to make a churna or a powder, it's not like that. Simply, when you start making a churna or a powder of Heda Beda Trifala, and when you start making a powder of the single herb like Kuchla, it's way different. So unless we are extremely keen to these processes, we are not going to get the desired results. And this is the challenge. And I think our people have taken this very lightly, that yes, if I just simply do the thing, what is mentioned, and it should be able to deliver the desired product. Unfortunately, this is not true. And since this is not true, it gives extreme variable results in clinical setup. And that is why there is a huge need to standardize our medicines, which is not considered as a serious threat to Ayurveda from being accepted and from being non-accepted as a rational science. This starts with simply I'm giving examples of churna or decoction, but when it comes to when you see these pictures, the sindoor is seen, the puttas are seen, and on the right side, quality control. Why these three images? So the sindoor, for example, it is seen that, let's just take a simple Paragandha Kajali. But if you look at the references of sindoor, you will find lot more references. Only Paragandha, some has some additives. What is considered to be authentic? What is to be used? That is a different thing. The second thing, when we start making a kajali, how much time we need to really do the trituration process? Okay, the simple reason is till you get the desired results of kajali. I mean the parameters when it is considered as a kajali is done. So is it that enough? Ideally speaking, the answer is no. When I'm saying no, then I do have certain things which I can tell you or show you very critically that it is not the simple case of just if you triturate the kajali for 6 hours or 12 hours or 5 days, then you are done with the best quality of kajali. It's not the case. And when you start with the wrong raw material, even though your rest of the processes are right, which again involves n number of specific places, specificities, then the challenges keeps on multiplying. So we don't get the Rasa Sindur, what we call it as Rasa Sindur. Why don't we call it as Hingul? These are again different questions which we generally don't consider as a serious questions. Then what is the amount of heat? When, what sort of heat is to be applied? There are hundreds of questions. If just come to a single simple process of a simple drug we consider as Rasa Sindur. Then it comes to, when it comes to the basmas, what is the raw material? How it is to be, the shodhan is to be made. Single kind of shodhan, we are the people who are, highly person specific, highly drug specific, so highly target oriented. So when these medicines are made, which process of shodhan is to be applied for what sort of indication or what sort of disease management, that is also not mentioned in granthas. So these are the I don't call it as a limitations of a grantha. Everything is mentioned, but we don't give attention to these things because those are not mentioned under one roof. So, and how much heat is to be supplied. When we know that the Agniman with is the concept mentioned in Rasashastriya, or it is called termed as Yogya. What is the amount of heat to be supplied? If you are going to give the, let's say, 40 putti bhasma, and if you go way beyond on 27th of putta, and even though you continue for the rest of the 13 putta, the product resulted is completely different than in given the rightly given 40 puttas. So everything is again a different world. We can keep on talking together, talking hours and hours together on simple one putta kind of thing. But I refrain myself because it's very exciting for me also to share these things with you guys. But considering the time constraints, and then on the right side, what you can see is the image with the quality control, which is typically Varitaratva is seen. But nowadays, do you know that any substance can be made Varitara without going through Ayurvedic processes? So, do you still consider it as an ingestible thing? Do you still consider it as a bhasma or a product is done? Answer is no. Again, there are n number of things which needs to be understood. The point over here only I'm trying to explain you is that let's not take manufacturing so lightly, because Ayurveda Shastra is not as easy as it looks. So we spent 25 to 30 years, and we spent a couple of years on each of the product to standardize itself, and then only we can expect the results which are unmatched and which can go beyond the what Western medicine can deliver today. Next, please. So these are the reasons I already mentioned a couple of days. A couple of those is that why these metals are considered to be so toxic are not showing unwanted side effects. This is a very important word, unwanted side effects. So for instance, the mercury is considered to be toxic, lead is considered toxic, arsenic is like that, cadmium we don't use, but these are the 4 most toxic elements considered. But according to our science, copper is considered to be worst or to be the most toxic element. We all know Ekadosho Vishe Tamretu Ashtadosha Smrtaha. Visha has only 1 dosha, but Tamra has 8 doshas. And if it takes, let's say, 1 year to make the right quality of Tamra Basma, we never consider this 1 year because we keep on doing. Why 1 year? Is there any significance? Is there just the process keep on doing? We use Hira Basma of 200 putti. What is the significance of 200 putti? We think that you just make the triturate it, then keep giving putta, again triturate, again put a 200, it's done. It's not like that. What we use in our clinical practice, when we use Hiraka in our clinical practice, it's not the Hiraka. When we use copper in our clinical practice, which was given exposure under process for more than a year, it's not only copper, it's not only tamra which works, but it's more than a year which works. How? What is the importance of Kal? We never consider the importance of Kal in this. Let's go to the basics. I always say that one needs to know the basics of Ayurveda. And we all know that all dravyas are panchamahabhutatmak in nature. So Prithivyak Tejo Vaiva Kala, Vaiva Kasha, Kala, Dik, Atma, Manausi, Navaiva Dravyani. This is as per the Nyaya Vaisheshik Siddanta or quoted in Tarka Sangra. So Kala is a dravya. Disha is a dravya. Sindur comes on the top. Urdhva Gati. Urdhva. What is Urdhva? Is the Disha. Samir Pannak stays at the bottom. Adho Disha. Adho Gamitva, Urdhva Gamitva, Tiryak Gamitva. So importance of Disha. Disha is considered as a dravya. Atma and Mana are also dravyas. Yatha Rasaha Tatha Atma. Rasayan can reach to the soul. We are going to see the interesting story of this. But again, I refrain myself from multiple things. But this Kal is very, very important. And there are no shortcuts, unfortunately, in Rasashastra. If you are supposed to do one product for 1 year, you have to process it for a year. You cannot expect results by doing processes within 2 to 3 weeks or 4 weeks or 1 month or 2 months. It's not like that. So we have to be very careful in that, because Rasashastra, like it can give life to multiple patients, but it can take your life if it shows the side effects which might be lethal, which might be dangerous. And in today's era, patient can sue you, because in last 6 months we come across 2 Vaidyas who have been charged with the drug toxicities in Pune very badly. And I myself personally helped them to get out of this, because it is not going to harm them only, it is going to harm Ayurveda as a science. So the only point is, what is the raw material, what is the processing, what is the time, and these all things are very important if we are not expecting any unwanted side effects, but very good unwanted side effects there, and that is why the processing is very important. Next, please. So, we keep on talking on Rasashastra for years together, literally years together, because it's so thorough and it's close to my heart and my mind. And 24/7 Rasashastra is in all the thoughts. So it's very exciting, and it's actually with heavy heart I want to enter into the main topic of today, is the cancer. Next, please. So when it comes to the cancer, what is the fact about cancer in India? So where India stands, so we are at 7.5% of cases in India as compared to the world. 7.5% share of cancer cases stays in India, whereas the mortality in India cancer patients is 8.5%. Only 12%, this is very important, and everyone to understand, 12% of cancer patients are diagnosed at early stage. So most importantly, 88% of patients are diagnosed at late stage of cancer. This is a huge statistics and considerably dangerous statistics. 71% of all cancer-related deaths are occurring in the age group of 30 to 69. Again, this is a very dangerous situation from different perspective, because 30 to, forget about 69, but at least 60, 30 to 60 is the age where people or the patients are most productive by all terms, by all means, in this age bracket, to their family, to the society, to the nation. But this is the age group where almost every 2 cancer patients out of 3 cancer patients are being diagnosed. And cancer being a life-threatening disease, this is not the threat to that particular patient, but to family, but to society, but to nation. So when we decide to do something in cancer, we have this always in our mind, that how can we contribute ourselves with the help of our great science and contribute for nation building, because this is extremely high way of national waste, these patients' mortalities. Then 1 out of 8 Indians is likely to develop cancer in their lifetime, and total number of new cancer cases expected to 14.13 is, this is a old statistics, because such kind of statistics won't come on every year. Now this year or next year, the next statistics will come. So this is the deadly facts about cancer in India. Next, please. So this year, you can see that the around 60% of cancer patients are diagnosed in locally advanced. So now we are going a little deeper in the subject, advanced stage. But now, what is the inset within the set statistics says? The locally advanced is 60%, and 50% are diagnosed with the distant metastasis. Are these figures signify something? Yes, it signifies a lot, and how, that's what we are going to see, of course. But this is a really very dangerous statistics. When it comes to the different types of cancers, then we can see that stomach leads to 50%, breast to 57%, cervical 60%, and head and neck 66%. Cancer as a locally advanced stage. And distant metastasis, 58% males to female ratio, but it is not very significant in when it comes to the gender-specific cancer ratios. So when we consider the 60% of cancers are locally advanced, so most of the visit to allopathic doctors, either surgeons or physicians, and they start giving their logic-based or the global data-based solutions. How it works, we are going to look at it at different times, but just remember these ratios are very sensitive for our nation. Next, please. So as we know, as I said, that advanced stage, so what are the challenges for our own patients? So all the data coming about cancer is coming from the West. And the data which is projected from the West has nothing to do with the data what we are seeing in India. And that is the major controversial issue. And unfortunately, no one is attending that. The RAAAUOS Cancer Clinic has taken and shouldered this challenge and decided to improve the outcomes in cancer patients in Indian population with the help of Ayurveda. And in very unbiased manner, we are trying to identify where Ayurveda can add substantial value And what our data says is significantly different than the global data, significantly different than the belief system of cancer patients, the belief system of oncologists in India. Next, please. So what are the limitations of chemotherapy, especially in metastatic disease? So the biggest limitation of chemotherapy is chemoresistant. So chemoresistance in solid tumors. So chemotherapy fails in 90% of cases with metastatic disease due to chemoresistance. And why this chemoresistance comes? Because most of the time, the tumor itself has resistant cells by nature. If not, if you keep on killing these cells have a right to survive. And this right to survive leads to resistance. And there are way more different mechanisms which leads to resistance to these kind of therapies. And unfortunately, once the resistance is there, then hardly any other treatment, especially from chemotherapy world, works better as a curative intent. So resistance is the one of the biggest limitation of chemotherapy. Next, please. So if that is the case, then what patient should do? Before that, I would like to emphasize on immunotherapy as well, because nowadays everybody talks about immunotherapy. Just last month I was in US, and we attended along with my colleague, we attended the global conference on cancer. You will be surprised that no one talks about chemotherapy anymore. Everyone talks about immunotherapy. And we Ayurvedic people must understand why this is a paradigm shift. Even though they talk about immunotherapy, it is not given alone in most of the cases. It is always given in conjunction, in adjuvant with chemotherapy, with radiation, something like that. And still, how it is going to be benefited, the scientists in this field consider this God only knows. Because it works again on a reductionist approach. It is based on a single line etiology. So why Ayurveda? Because there are late stage cancer diagnosis in India. All the drug development happens in the West, where these patients' diet, their genetic composition is way different than Indians, and such drugs develops in the West are really useful for us is the main question. On the other side, it is a fact that there is a limited documentation of outcomes of Western medicine in Indian population. The other most important thing is that the influence of Western medicine on Indian population. This is again very important thing. Decision making is a very complex thing. It's not easy to make decisions. Of course, we know it much better sense because we deal with only chronic and critical patients. 90% patients what we deal with are only life-threatening. So it's not easy for these patients, and they visit our clinic only after in a devastated condition, or only after exhausting all the available possible options from the Western medicine. Hence, we don't have any other option than to opt for only quality of life and the overall survival of these patients. That is where Ayurveda plays a vital role. Next, please. So we can talk a lot on resistance, why, how, etc., and how to deal with it. But let's summarize the clinical conditions where Ayurvedic graduates, Ayurvedic oncologists have got a lot of opportunity. Chemo resistance, we have seen the refractory cases, the patient do not respond to these. Then prevention of relapse, once it is taken care, surgery, or by chemo, or by NACT kind of protocol, cancer has to come back. It's the nature of the disease is like that. So prevention of relapse is very important. Then reduce the risk of metastasis. Already metastatized, or primary care has been taken, or simple small metastasis is there. One has to reduce the risk of further metastasis on the way to improve the quality of life. At times, we don't have any other option than to take care of patient at home with the help of home-based, safe palliative care for end-stage patients. Then there is a class still started recently visiting to RAAAUOS Cancer Clinic who opt for exclusive art treatment and decline for conventional therapies, or they are not eligible for conventional therapy because of the comorbid condition, liver is failed, kidney is failed, etc., or quite aged and so on. Better quality, people at times don't ask for better quality of life, but better quality of death. So that is also very, very important. And most of the time when you consider this in the era of immunotherapy, where the cost of the cancer treatment lies between 2 to 6 lakhs rupees every 3 weeks, which most of the Indians can't afford. So society, our nation needs something which is affordable to our own people. And that is our principal duty, to think beyond our own self, think for a society, think for a person who is suffering from a cancer, think from the group of patients who are suffering from cancer, and how can we make breakthrough, how can we make their lives much more better than as compared to whatever is available today. Next, please. So when we talk about cancer, cancer is not mentioned in Ayurveda, as we know. So how to deal with the cancer? And that is the reason why cancer is not being well taken by Ayurvedic fraternity. What are the principles? What are the drugs? What are the therapies? So it's very difficult to extrapolate the approach towards cancer. And what we learned is that whatever the drugs are given are based on dosha sammurchana or hetus of those particular times. Nowadays, the hetus are changed, doshas are changed, dhatus are changed, everything is changed. So it is a question that if my input is changed, how can I expect the same output on the basis of wrong input? And that's the challenge in front of cancer treatment. So what is the siddanta? And why what we are telling is how much is scientific and rational. One cannot simply believe that somebody is saying that. No. Nobody, world is not moved by such kind of things. Baba Vakyam Pramanam is not what the world is looking for. So siddhanta, most of the times Ayurveda is being misunderstood because they think that it is old or ancient. The common term given to Ayurveda is ancient. No, Ayurveda is not ancient. Please stop saying Ayurveda is ancient. Ayurveda is Shashwat. Shashwat by which means? The Shashwat by means of siddhanta. So what is siddhanta? So siddhanta nam yasya sa parikshakaihi bahuvidam pariksha. We all know this. The Charak Mimanstam 8 has said it. Bahuvidam pariksha. परीक्ष बहुविधम परीक्ष हेतुभिश्च साधयित्वा स्थाप्यते निर्णयः. See, it is not one person is saying and then it is being accepted in Ayurveda. So even today, we don't believe that somebody X is saying and let everybody believes it. No. Is it tested? Is it time tested? Is it validated? Is it peer reviewed? If this checkbox is yes, 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 then it is acceptable. And Rasayu Cancer Clinic or all our work is following this particular definition of siddanta mentioned in Charak Vimanstan art. And then only you can be confident. You can take Ayurveda to the global level with extreme confidence, and you don't have to care about anybody, what they are saying against you or aligned with you. You are always right because you are based on Shashwat Siddhanta and the approach, which we consider not only for Rasayu Cancer Clinic, but Rasayu Ayurveda Clinic, even in Ayurveda Rasayani. Next, please. So that's what we talked about. Is there any mention of cancer in Ayurveda? The answer is no. And that is where the importance of fundamental comes in. Next. So, okay. So can you go to the earlier slide, please? Earlier slide, Amol. Okay, and the next one. Acha, tasa kelega then. Okay. So everybody is looking at this is a white page, right? Forget about the title. And now this is my typical example. And now what we are seeing is a black dot. Am I right? Can anybody answer? Yes.
Yes, sir. Yes, sir.
Perfect. So when we see the black dot, earlier we have seen the white paper. Later we have seen the black dot. But knowingly, unknowingly, subconsciously, even though we can see that, we didn't register the white paper, we registered the black dot. This is exactly the mistake which is being happened by the Western scientists when they look at cancer. Cancer is happening to the body. And when cancer is diagnosed, body is forgotten. But if the cancer is diagnosed at the age of 65, why that person got the cancer at 65 and why not till 64? Who worked for this body? The whole body, the system, all the organs, all the cells, all the systems, your immunity, your mind worked not to get cancer for 64 years. So, should I believe on my own which worked, proved themselves for 64 years? Or should I take everything in my hand and start looking at only black dot or cancer and start eliminating that black dot from the body without considering the body? The logic and the science is very clear. But the commerce is driving our mind and science, unfortunately. And this is not Ayurveda at all. What Ayurveda is, always look at the white paper and look at the black dot on the background of white paper. That is very important. Very, very important in cancer treatment. Generally, that is why we call it as Kali Yuga. We have become too opportunist. We have become too selfish. We have become too narrow-minded. But the view of Ayurveda is very broadened. In other words, it can be considered as Sarva Samaveshak. If I want to walk far, I can walk alone. But if I want to walk with the team, then my speed may be very less, but I can build a great group of like-minded people. I'm not expecting a narrow-minded people to walk with me. I'm not expecting a selfish people to walk with me. The only people who can think beyond, who can think big, who can think for the society, who can think for the nation. That is exactly the thought process. It's similar in cancer management. Let us think about what is good. Let us not think about what is bad. So what is good inside the body? This cancer tumor is hardly 3 centimeter or 4 centimeter. It may composed of couple of billions of cells, but body is composed of couple of trillions of cells, more than 70 trillion cells, which are good. So I am concerned, I should be cared for the good. Then obviously the question remains then, how to deal with the bad? It is very difficult to accept this, but ideally we should ignore the bad. We should ignore which is not as per the niti matta or naitikta or morals, based on morals, because this is what we learned in Sadvrutta in Sutrasthana also. Same thing applies over here. Forget about the bad cell. Focus on the good cells. The moment you focus on good cells, the evil gets eliminated automatically. You don't have to look at the evil. Forget about that. In real life also, Kshama Virasya Bhushanam. This is the same. You forgive them. The moment you forgive them, you start focusing on the right things. And the right thing in oncology is to focus on good cells, immune cells, normal cells. Next, please. So this is very interesting to know what Gita says. In Gita, Bhagavan Sri Krishna says, Jatasya hi dhruva mrityu. Whoever has taken birth has to die. Normal cells die, abnormal cells die. Isn't it applicable to cancer cells? The actual answer is yes. We did these experiments in our lab. We did this in our cell lines. We have observed this in our patients. Jatasya dhruva mrityu. These abnormal cells have to undergo natural cell death. The cancerous cells has to undergo natural cell death. And yes, it goes like that. They do follow this kind of principle because it has taken a birth, it has to die, is the Shashwat principle from Gita. There is no one, including Bhagavan, own Sri Krishna, is no more with his physical body in today's world. He also have to go on a deathbed. So why can't these abnormal cells, which should be the exception to this? It is not. Next, please. So Utpatti, Sthiti and Laya. This is the Srishti, Nirmiti and Siddhanta for Srishti Laya as well. We all know Yatha Loke Tatha Dehe. So Utpatti, Sthiti and Laya. You can correlate this with Brahma, Vishnu and Mahesh. Now think, this is very interesting. Utpatti, cancer can be formed with the wrong cells production. But the normal cell is being produced, and on the way of cell division, it can become cancerous. On the way of its lifespan, it can become cancerous. On the way of its death route, it can become cancerous. So there are a couple of many factors which controls this Utpatti Sthiti and Laya Siddhanta. And that's why this figure depicts the importance of Brahma, Vishnu and Mahesh. You cannot survive without any one of these. You have to have all three gods in equilibrium in your body, then only cancer cannot happen. If any one of these goes haywire, then cancer starts. So, what is the definition of body or sharir? Actually, shiryate tat shariram. The simple definition of sharir is not being made by any other science, so critically well formed, well with the great thoughts and extraordinarily scientific. What degenerates his body? So, cancer cells is a product of degeneration. But then how do we grow? Because the rate of regeneration is much higher than the rate of degeneration in earlier stages of our life. What happens to the later stage? What persists is degeneration. What is predominant is degeneration. So where we should focus on regeneration, and this is where Rasayan comes in. Unfortunate part is, in India, couple of hundreds of thousands of Vaidyas are working, but no one is working on Rasayan. No one. Now look at this. Shiryate tat shariram. And we need to regenerate. Rasayan is important. Rasayan is pertinent. Rasayan is one of the 8 branches of Ayurveda. It is connected with the rest of the 7 branches of Ayurveda also. But we do not practice it. We don't focus. We don't work. We don't take our own things seriously. I'm sorry to mention, but the point is, it is not the problem of our Vaidyas, but the problem of our mind. Our minds are deviated. Our minds are controlled in such a manner that we get driven by lot more things and then keep on inculcating those things in our own practice, and may be driven by our own selfish things which gives us quick results or immediate gratification in our personal practice. It's very complex. It's not single, or it's not very linear. It's a very, very complex thing. Likewise, like the cancer is. But when we look at these things in a simplified manner, we can easily understand. And I don't think anybody of you want me to convince the importance of Rasayan when we connect these dots. So this is very pertinent in cancer treatment to establish the normal cell cycle. This is in cell biology language. It is called as cell cycle rhythm. Brahma, Vishnu, Mahesh. Next, please. This is a great slide, and I can keep on talking on this slide for 2, 3, 4, 5 weeks together. And with last 20 years of our experience with Ayurveda patients, etc., when we look at cancer, then cancer is the disease of the organ or the cell. That is how it is being projected. But when we look at cancer, it is not only the cell, it is not only the organ, it is not only the system, but so many things we have to consider while dealing with cancer. So it starts with the organ, then system, then Moolastan, then Prakriti. What are the causes of cancer? I remember a case of a patient who was suffering from a throat cancer. He has a very typical hetu of eating every day banana with milk. Every day banana with milk for about 20 years. He presented with throat cancer, or pharyngeal, they call it as. Very classical hetu. But not always it is so simple. Not always. Smoking kills. I have my own understanding of smoking leads to cancer. We must look at the statistical data. How many people smokes? How many get cancer? At the same time, why people don't get cancer who smokes? At the same time, why those people only get cancer who smokes? Vis-a-vis who don't? That means smoking is not the only criteria. The criteria for cancer is something else than the smoking. And that is where the Ayurveda comes in. That is where our understanding of hetus comes in. Distant hetus, immediate hetus. Then Trayopastamba, what we have, Ahar, Nidra, Brahmacharya. Sarasaratva plays a vital role. Family history plays a vital role. But what is cancer? Cancer is nothing but the abnormal growth of cells. It means it has two inherent phenomena. One, cells are regenerated and they keep on multiplying. That means Janana and Jivana are the two important karmas involved in cancer process. So when we revisit Sreshtham Karmam Karmachmurtam, this reference, Prinanam Jivanam Lepo, Sneho Dharana Purane. So Jivan and Janana. Jivana is the main principal karma of Rakta Dhatu. Janana is the main principal karma of Shukra Dhatu. And cancer cannot happen without the involvement of these two dhatus according to Ayurveda. So we have to consider these things. And then most important, without that, we cannot even think about treating cancer or even think about understanding cancer is the Agni. Jatara Agni, Dhatu Agni. And also most important, that's why I made a little emphasis on the manufacturing processes where the Agni is also plays a vital role. And malas and formation of malas till the excretion of malas. These all things plays a very vital role in understanding of cancer. This is quite complex. It is rather extremely complex. But one has to have a proper understanding of all these things at once and then decide the action or the way forward. That is what we have done on literally day and night for last 27 years. And that is why we come up with the simplified solutions with having the understanding of all these complexities and delivering not only a drug, but a therapeutic regime or protocol for cancer patients. And this is the master key to conquer cancer. Next, please. And through Rasayan. That's why I made emphasis on through Rasayan. So why Rasayan? We talked about Rasayan. Why Rasayan? Shiritatat Shariram. But what is the importance of Rasayan in cancer? What Rasayan gives according to the Charaka? Dirghamayu Smruti Medam, Arogyam Tarunamadaya, Vaya. These are all standard benefits of Rasayana. I just want to give only a small talk on first word, because this is how the granthas have been written. Most important thing is given priority. We give priority to most important people, VIP patients. Why? Because they are important for the society, for the nation. Likewise, what Rasayan does is Dirgham Ayuhu. So what is Ayuhu? The definition of Ayuhu says, Sharirendriya Satvatma Sanyogo Dhari Jivitam. Sharira, Indriya, Sattva, Atma. All putting together, connecting this together is called as Ayu. And Rasayan gives you Dirgham Ayu. Dirgham. If you any one thing from this cycle goes to inequilibrium or deranged, then Dirgham Ayu won't happen. If one is expecting Dirgham Ayu, then Rasayan is very, very important. So Rasayan, what it does? Sharir, Rasayan for Sharir. Indriya, Rasayan for Indriya. Atma, Rasayan for Atma. Sattva, Rasayan for Sattva. And Rasayan, fifth most important dimension of Rasayan is connecting to everything. All these things, connecting to all these things is also the pertinent job of Rasayan. Why my hand is like this? Why our everybody's hand is like this? Why during the process of embryology, this thumb stops growing up till here? What has made to differentiate from this area and limited growth, which is more than in lengthwise, more than a thumb, to my index finger? Why it stopped here? Then again, division of the other finger leads to little longer and stopped here. Why not this finger keep on growing and growing and growing? What is making these cells to multiply? And what is that which controls the multiplication? Smriti. We always consider Smriti, and the misnomer for Smriti is memory. Smriti is way broader term in Ayurveda than the typical understanding of memory. When I recall something which I have seen a week back, or I recall the story of a movie I have seen, that is not the Smriti what Rasayan is established. Smriti works at a cellular level. Smriti works at a micro level, very minute level. So these are the characteristics of Rasayan, and one has to develop these Rasayan in which are important and pertinent in today's times by considering today's hetus. So on the right side, you can see that these are all typical things which Rasayana gives. I don't want to get into those details because we have to move further, and we are already short of time with that. But my point is only to give you the vision why Rasayan is very important for cancer. Next, please. So when patient comes to our clinic or your clinic, they comes with a post-surgery for prevention of recurrence or prevention of metastasis. Post-surgery. Then our plan is to give gold standard protocol, which includes Vyadhi Pratyanik Rasayan. This is very important to know. Yad dosha pratyanikam tat na Vyadhi Pratyam. This you have already heard from me when you have visited signing. But Yat Vyadhi Pratyanikam tat avashyam dosha pratyanikam. We are always focusing on doshas. Vayoho ratri bhuktanam te antamadhyadika kraman. Doshas keep on moving all the time. 24/7, you are at the age of your life, any stage of your life, lifelong, even in nature, these are always in the dynamic equilibrium. So controlling the dynamic equilibrium is not that easy. And that is where the entire paradigm shift from Arsha Grantha to Rasashastriya has happened. And that is where the Rasashastriya has delivered the Vyadhi Pratyanik Rasayan. The only limitation what Rasashastriya has, as per the documents or the documentation, is that the sampraptis are not explained as explained in Arsha Granthas. And it is called as Rasashastriya Samprapti. Understanding the disease from Rasashastriya angle. And that is where the Vyadhi Pratyanik Rasayan comes and plays a vital role. Then complementary Rasayan when patient is taking chemotherapy or something. Also diet and yoga. And when patients are visiting you while on chemo or radiation is going on, then the objective should be to reduce the tumor, prevent the metastasis, reduce the side effects of chemo. This is the expectation from a patient. We at Rasai Cancer Clinic never accept these patients who comes to exclusively for side effect management of chemotherapies. With due respect to the Western doctors, with due respect to the need of the patient, but we do not entertain, do not accept these patients for treatment. Business wise, is it loss? Yes, it is loss. But when it comes to establishment of my science as a rational science, even though I am lost as a person, my patient will get a message that Ayurveda is not a science to be taken easily as a secondary science. I am here to treat this patient. I am here to treat this patient who is suffering from cancer, and I am committed to reduce his pain or to improve his quality of life. But secondary management is not what Ayurvedic Vaidyas must do, because I firmly believe that Ayurvedic Vaidyas are super specialists of the super specialists. Because you are doing what cardiologists can't do. You are doing what oncologists can't do. You are doing what neurologists can't do. You are doing what hepatologists can't do. You are doing what pediatricians can't do. These are all super specialists, isn't it? And then if you are considered to be super specialist and you are doing the job of a mediocre physician, no, that is not my Vaidya should do. That is not what Ayurveda is. Ayurveda is way beyond our current understanding of medical science. And I do stress on this statement that Ayurveda is not a medical science. Please do not consider Ayurveda as a medical science. Ayurveda is science of life, in which medical or the medicine is the smallest part of our life. It's not the whole, it's the smallest part. It's giving you way beyond in intentional dimension for how can we make our life much more happier, healthier, and longer. That is what Ayurveda, we all know. But when it comes to the job of a physician, we get involved into mediocre jobs, which we never do. And I would expect none of us should do that. I strongly condemn this statement that Ayurveda manages the side effects of other sciences. No, let's not promote Ayurveda. Otherwise, you will always remain as the side effect manager. And that too, one part of the side effects, not that all side effects you can manage. And that too will bring yourself and your science as a low level of working kind of people, a class, group, and science also. So that's not what we do. But when we deal with these patients, we explain all these things, again give Vadipratyanic Rasayan, complementary Rasayan, diet, and yoga. But these, both the classes are all comes from 12% of these patients. 78%, 88% belongs to third class advanced stage, not eligible for chemo or radiation or surgery anymore, and visiting to Ayurveda. That is a larger portion of patients we have to cater, where our focus is on increasing the lifespan with the quality of life. And in such many of such end of life these patients, we have delivered, with the help of Vyadi Pratyanic approach, tumor regression, which is the first, foremost gold standard understanding or the acceptance at global level for cancer treatment. So even though the patient is refractory to chemo or radiation, there is a hope through cancer. There is a through Ayurveda, there is a hope with the help of Rasayan. Next, please. So Rasashastriya in cancer management, you can see this is the periodic table. Next, please. And now we just keep on touching certain things, and then we are going towards the end of a talk. So this is very important, Rasashastra, importance of Rasashastra. Siddhe rase karishyami nirdaridram idam jagat. Or ekasu rasaraja sarvam shariram ajramaram kurta. Single rasa can help the world be, out of poverty. Nirdaridram idam jagat. So this daridra is not in the context of wealth, but health is wealth. And the Rasa Shastra has the power of making healthier society, healthier nation, and healthier world. And that is what we have done, and we have experienced with our global patients' treatments. Next, please. So what is our therapeutic approach of Rasayan? I already talked about that. We do not directly kill cancer cells because Jata se dhruva mrityu, we know, we accept it, and we understand. So it is not like chemotherapy. Then how the tumor goes? By creating homeostasis, by creating equilibrium, by bringing these abnormal cells on the track of normal cells. There was an article, and one of our scientists sent that article to me, that there was a laboratory in Japan who worked in cancer, and now they have discovered the mechanism, this mechanism which will bring these abnormal cells to the cancer, to the normal cells platform, and then help these cells, or they help these cancer patients to get rid of tumors. And one of our scientists sent me this. He was very kind in writing that, sir, this you have delivered 15 years back. Japan is 15 years behind, at least Rasayu Cancer Clinic. Forget about in India. So this is not about Rasayu Cancer Clinic. This is about Ayurveda. This is about Rasayan. And this is about understanding of Rasayan. So what we do, we potentiate the normal cells. We potentiate the immune cells to fight against the abnormal cells, and abnormality goes away. We try to change the abnormality from the cell. Whole cell is cancerous. Yes, we do understand. But there are still the organelles inside the cells which are normal, which are functioning normally. Isn't that your capital? So every cell has, let's say, 30% of good part. And all the billion cells which are considered as a tumor has got 30% good cells, or good part of each cell. That's my capital, in addition to the whole body which consists of good cells. So I want to work on the normal cells, immune cells, and then the abnormal cells eventually die. That is the principle behind Rasayan. That is where, and this is the global principle. Of course, we develop these Rasayan as per the stage of the cancer, type of the cancer, organ which is involved in the cancer, and so on. Next, please. So obviously, we use a lot of bhasmas and sindurs and everything for this, making these Rasayan. And we never use a Rasayan, a bhasma in Rasayan, which is less than 100 putti. Less than 100 putti, yes. It takes average minimum 1 year for one bhasma to be used in one Rasayan. So the back-end work is too huge and too complex, but that is the need that has to be done, because every life, every single person is equally important for myself, my science, and establishment of Ayurveda as a rational science in today's turn. I never consider cancer is happening to the person. I always consider cancer is happening to the family. Cancer is happening to the society. And That is very, very, I presume that's a very good service to the humanity. So if we are serious with our service, why shouldn't we be, anxious or make or start doing shortcuts for such kind of things? So no shortcuts are allowed in such kind of serious business. Next, please. So, all this is, you are all from Rasashastriya, intelligent people, all are postgraduate and great practitioners. So I don't have to tell you all these things, but yes, Rasashastriya, these bhasmas do contain nanoparticles. And people can say that this is the origin of nanomedicine and so on. Next, please. The role of metal, I am deliberately giving you certain things because sometimes still, I'm not personally as of this opinion, but sometimes these things may give you different dimension or may add to your confidence level. That's why I'm going to give you these kind of quotes which are published in most reputed global journals. So metals and these nanoparticles have demonstrated the anti-cancer effects. Several researches are done and ongoing for the anti-cancer and drug-carrying properties of metal. So world is still way behind us. They are still thinking that these bhasma particles or these metal nanoparticles can be used as a carrier. We are way beyond, way ahead of this current understanding of metallic nanoparticles. Next, please. Even though we look at oncology canvas, we may come across listening to multiple things are happening in cancer. But is there any serious thing happening in cancer? Answer is really no. The noise is too much. The delivery is questioned. These are the new generation anti-cancer agents, which is based on metals people are trying to develop, but they are not yet developed. We are way ahead of them. Next, please. Swarn is again one of my most favorite rasayan, metal, dhatu, drug, you may call it as. And we use, of course, again, Swarna is not below any 100 putam. And you can see the qualities: snigdhyam, medhyam, visha gadaharam. Visha gadaharam. Cancer cannot happen without vishaktata. Cannot. We cannot identify its a toxicity because the understanding of toxicity in our mind is completely different, which is driven by the Western understanding. And that is where you need something which works against Visha. Vrusham agryam. Many things. Sarva doshamayagam. Many places we use Swarna, but not all places we use Swarna. At the same time, you must understand. Next, please. Gold is extensively researched and found to be excellent anti-cancer agent with immunomodulator properties. 21st century, they took to reach to 21st century to have this understanding about gold. We had this understanding since ages. But still, they think that gold can be only a drug carrier, which is not a case. We have n number of proofs and scientific establishments which shows that gold has its own therapeutic properties. It is again seen that gold has got anti-angiogenic, anti-tumor properties. Both we have seen, we have established. The process is very important. Which gold gives you anti-cancer property? Which gold gives you anti-tumor property? Which gold gives you anti-angiogenic property? The gold which we use in Therex is not the gold what we used in Protha Rasayan or Pinzar Rasayan or any other our respective Rasayan which we make, subjective Rasayan for our patients in clinic called as Mahayushya Rasayan or Navajivan Rasayan. It's never one size fits all. Then and then only you can talk confidently, that too on a global platform. So it's not that easy how it looks. Next, please. Rajata, Raupyam Shitam Kashayam Amlam Snigdham Vataharam Guru. Vata plays a predominant role in cancer cells division, as we know, and hence the Raupya has got a very unique position in cancer management. Next, please. What the science, Western science says, it is potent anti-tumor agent, and it helps in stopping the spread of cancer by activating the apoptotic pathways. Again, it is anti-angiogenic in nature. Next, please. Tamram Tiktam Kashayam Cha Madhuram Paketha Viryasnakam. This is a big slok, and Tamra is one of my most favorite drug and a great rasayan which can be useful for anti-tumorigenic potential. Next, please. It is mentioned that Urdhwadha Parishodhanam. I remember I talked on this when some couple of your doctors visited Ayurveda Rasayani, and I can talk on cancer for next 2 hours, but let's stop over here. Let's see what Western people says. Copper nanoparticles, it can initiate DNA degradation process and induce apoptotic cell death, which is important phenomena in cancer management. Can we take the same copper nanoparticles? The answer is no, but they know that copper has got anti-tumor potential. Next, please. Jasada, again, one of my most favorite drugs. Not very easy to deal with it because it is a very deceptive, yes, I use the word deceptive metal, because you can make apparently Jasad Bhasma easily. But my friends, it is not Jasad, it is zinc oxide what you make. There is a way difference between zinc oxide and Jasad Bhasma. And that is the reason why Ayurvedic Jasad Bhasma do not give miraculous results as which is explained in the texts. Because it easily gets oxidized. And then once it is oxidized, we consider, oh, it is powdered one, it is thin. Now you can see easily with the Rekha Purnatva, and that's it, my Bhasma is done. No, it is very deceptive. So we have to think beyond these things. Some things appears to be easy, something appears to be very difficult. Nothing is simple. Next, please. Zinc again helps to activate the apoptotic proteins, and it restores the drug sensitivity and prevents for the drug resistance. Next, please. Next, please. Loha. Loha, as we all know, Loha is very commonly used in multiple things. The first word is Ayush Pradata. Again, it works on Ayuhu, Balavirya Karta, and so on. Next, please. Iron oxide nanoparticles, which is we do not produce oxides, by the way. We should know this. We do not produce oxides. So, but iron oxide particles are anti-cancer agents and sustained intracellular drug retention, and helps for the anti-proliferative effect of iron in breast and prostate cancers. That is where they studied. And iron complex also shown to be effective in selective anti-leukemic effect. Next, please. Hirak, everybody knows that I love Hirak like anything, and our own consumption of Hirak Bhasma in the single clinic, not from the market at all, is about 4 kilos per annum. It is not that some people may think that this is the stage where you shouldn't use Hirak. It's fine. We never use Hirak over there. But unfortunately, the number of patients is too high, number of critical patients is too high, and the stories where we use Hirak is extraordinarily different. I can share you the interesting story of a patient who was suffering from HER2 positive breast cancer. And she presented with HER2 positive breast cancer with stage 4 with multiple mets, including bone mets. And she was advised to go for Herceptin and chemo. She opted only for Herceptin and without chemo, and Herceptin plus Ayurvedic Rasayan therapy. That was where she started the treatment. But after a while, she was supposed to go for 15 to 18 cycles of Herceptin. But after 2 or 3 cycles, she decided to stop Herceptin and continued with exclusive Rasayan therapy at Rasayan Cancer Clinic. She was advised this overall survival for maximum 2 years with all sorts of treatments. But after 7 or 8 years, she was sustained exclusively on Rasayu Cancer Clinic's protocols. Lately, she got the advanced stage, and she had the secondary at the upper 1/3 of humerus. And when we seen the X-ray and did the PET scan, and we were shocked to see the cancer grown up over there, how her hand is staying there. It should have, fall by now. And she started getting excruciating pain. And I was abroad at that time, so we advised them to, if we can't see you in that pain, so maybe you can try for pain management. And she was put on a couple of morphine drugs along with heavy doses of morphine patches, and a lot more other than non-opioidal, non-inflammatory, and anti-inflammatory non-steroidal drugs also. But she became worse, and then she didn't have any other option than to continue that. But we decided, we have taken a very different route at that particular time, and we stopped all our medicines. And she was only on morphine and on those painkillers. We stopped all our morphine, all our Rasayan therapy, and started high dose of Hirak. 2 capsules 5 times a day. 2 capsules 5 times a day. After 1 week, she could differentiate that she is not in need of pain management drugs. After 2 weeks, she stopped all those kind of things to nil, stopped morphine derivatives, and exclusively continued on high dose of Hirak and Somtajvir. Somtajvir is the Rasayan, which we again give for very particular stages. And she continued only on 2 drugs with extremely high dose of Hirak and only Somtajvir, if I am not recollecting wrongly, then 2 times a day. Still, then she survived for more than 2 months or something like that, when she was, expected to die within 2 to 4 days. And then eventually she died, but with extremely good quality of death. But the patient who was given the overall survival of maximum 2 years survived for more than 8 years putting together. That too with hardly last few days in pain. That too we reduced, and she died peacefully. That is the power of Hiraka. We do have thousands of stories of Hiraka, different doses at different stages, different diseases, and so on. Next, please. Let's see what the Western people who work on diamond nanoparticles says. The carbon nanoparticles promise a multifaceted benefits in transporting drug. These carbon nanoparticles are derived from diamond. So this is called as nanodiamond. Next, please. The overall, these metals are used under the pipeline to potentiation of chemotherapy or radiotherapy. Next, please. So all said and done, what are the limitations of current approaches? We are talking about the approach. We talked about the nanoparticles of metal. Why there is no drug? Because there are limitations. What are those limitations? Next, please. So chemotherapy can promote disease. This may shock to you that chemotherapy can promote cancer growth, spread, and chemoresistance. Yes, you heard rightly that chemotherapy is proven to damage the tumor microenvironment and release a protein which promote growth of the tumor. And this also leads to chemoresistance. Next, please. Chemotherapy and drug resistance. So as I already said that the tumor has got mixed population, malignant, drug sensitive, drug resistance, and so on. So chemotherapy, some sensitive cells may be killed with chemotherapy, but rest of the cells, they rebel, and that is the failure of chemotherapy, which leads to chemo resistant, and this all eventually leads to change in the environment of cancer cells, and again, which leads to death of cancer patient. Next, please. This is again very interesting to know that chemotherapy and second cancer, not secondary, because some cancer treatments such as chemotherapy and radiation leads to second cancer in cancer patients later life. We have got lot more patients suffering from second cancer, and it is so pertinent and it is even shocking to know that second primary cancer has come to the level of sixth most common group of cancers. It is so dangerous. So where is Vishuddha Chikitsa? Where is understanding of therapy? Where is understanding of disease? It's all gone for the toss. There is no Ayurveda anywhere. But we have to take Ayurveda at all levels. Next, please. Because all these drugs are based on one drug, one molecule, based on one particular line of etiology. It's called a single line of etiologies. Next, please. So multigenic, not a single disease is being formed with a single line. There might be multiple hetus. And this mistake, like what Western medicine is doing, I am sorry to say, many of the Ayurvedic Vaidyas are also doing while understanding a disease. Because, for example, we consider curd as a hetu of all the diseases. It's not like that. We know curd is one of the hetus, but we know thousands and thousands of patients who keep on consuming curd even at night, but they are healthy. That means curd is not that bad as we look at it. Of course, for many patients, it can be hetu. It can help in, stimulating the other hetus also. But let's not get carried away by our own belief system. We do have our belief system, but let's have open mind to change. Unless we have open mind, we cannot look at things in a positive manner, in a respective manner, in a appropriate manner. So many diseases are all multigenic, multidimensional, and hence has to be multi-targeted. That is why our Rasayan is having multi-ingredients. So people may think that you are polypharmacy guys. No, we are not polypharmacy guys. We attend each and everything respectfully, respectively. And that is where the whole body, whole system approach comes in. Next, please. Combinatorial and multi-targeted approach. That is what Ayurveda is. And we advise diet, we advise yoga, we advise Rasayan, we advise other Rasayan, other Rasashastriya medicines also. Next, please. So these are the benefits because of multi-drug, multi-compound therapy, because less chances of developing resistance, improved bioavailability, increased efficacy. Next, please. bedside to bench approach. Let's not get into it because it is related with drug development. Next, please. Yeah, this is very, very interesting case. I want you to first listen to me. This is the story of a patient. Wait, Amol. And this patient went to ICU for multiple times. And when she went to ICU at last time, she was on ventilator. Earlier also she was kept on ventilator a couple of times, but at this time she was put on ventilator, and then they, with the consent of the family people, they took her off ventilator and sent home with the survival of 4 days. 4 days survival. She is a known patient of dementia. She couldn't recognize her own son, couldn't recognize her daughter-in-law, and were not at all in her senses. She had a fall. And the tibia came out of the body. Here you can see the broken bone came out of the body. And obviously there was nothing which could be done at that stage because the life expectancy given was hardly 4 days that. And that evening they visited our clinic. We have come up with an interesting thing. In Rasashastriya, there are rasayanas. We developed a rasayan, we call it as Pran Rasayan. We believe in Atma. We believe in Sharir. And when there is Atma and body together, then there is a life. When they dissociates, it's nothing but the Mrityu. So, but she was in excruciating pain, and this Atma is not ready to leave the body at times, these certain conditions. In a lot more cancer patients, we have seen this, we are seeing this. And we have to have something very innovative, which works on this principle that either let the Atma leaves the body peacefully, or let the body tries to reduce the pain. That is only the job of a Vaidya. Vaidya cannot stop Atma from living, because that's not in our Prayatnasya Prabhu Vaidya, na Vaidya Prabhu Ayusha. This is the principle. Prayatnasya Prabhu Vaidya. So we were very keen in our efforts. How can we reduce the pain of this patient? Pain in multidimensional. So there is a method we have developed at Rasayu Cancer Clinic. We start with Pranavallabh Rasayan, 1 capsule a day for 7 days. Then 2 capsules a day for 7 days. And 3 capsules a day for 7 days continue. Pranavallabh Rasayan works on Dasha Pranayatana. All these sites of pranas. If prana wants to leave, can leave. If it wants to stay, then at least the body takes care of it. And what is going to happen, nobody knows. Even we never know. So we explain this thing to patients' relatives very well. The patients may die within the first dose, may die while they are on 1 dose. But if they keep on sustaining, there might be a position or a situation that patient may improve. Here is the application of a scientific principle, yatha rasaha tatha atma. Rasa can reach up to Atma. And now, this patient, we have started giving with 1 capsule, continued 3 capsules for weeks, and they continued, and she survived. After 1 year, we have been watching her, we have been getting the reports. We get to know that she has celebrated her next birthday. The same day, the children, her son and the daughter-in-law visited our clinic, saying that my mother, now recognizing me, started talking about the memories, what she had. She started fighting with this daughter-in-law like before. And what happened to the wound, you can see in video. Amol, please play. The bone was broken, but the healing was done. Completely 2 sections of bone was there. Full crack. It is not the partial crack. It's 100% two different pieces of bone was there. This can happen with one drug only, Pranvallabh, and we use the Gandhak Dhruti, what we use in our clinic. Single drug, miraculous results with the help of Rasashastriya. And this patient is still alive, and we could reverse, not completely, but partially, her dementia, because Smriti, Rasayan, Pran, they all goes hand in hand. Next, please. So what we talked earlier before this video was considerably called as you may call it as a theory, but it's all theory is based on the practical only. It's not theory at all. But one might think that, oh, yeah, theoretical. Hey, it's not theoretical. It is what we live with it, and our patients are live with it. Next, please. There are certain case studies, very recent, few case studies I'm going to talk very in a faster manner. Next, please. This is a patient of 70-year-old female. Can you move a little faster on the next slide, please? There is a summary so that we have to go a little faster. Amol, next, please. Here on the right side, you can see the patient with left mastectomy, status metabolically active deposits involving the left chest wall. This is a primarily operated case with the residual tumor. Next, please. This is the treatment given. Protha Rasayan, then Chandraprabha, Gokshur, Shankavati, Ashwagandha, and so on. Hirak Rasayan, Dasma Rasayan, which we use a lot in cancer, which is a great combination of Hirak and Tamra. Specialized Hirak, specialized Tamra, putting together in a specialized manner for a very innovative Rasayan, catering the needs of cancer patient in today's times, considering the today's hetus. And Sindur Bhushan Rasayan, which obviously needs, which obviously works on every dhatu pariposhan krama, every dhatu agni. That's why Sindur Bhushan was given. Next, please. And here you can see post 2.5 years of RCG treatment. You can see that the resolution of previously seen FDG avid pre-sternal and left axillary soft tissue, persistent FDG avid subretinal, but which was not considered as the malignant SUV score. But and they call it, that is why they call it as a partial treatment response, but this is exclusively with Rasayan therapy. Next, please. These are the scans. Next, please. Post-treatment assessment is called as FACT-G. You can see all the detailed things, how it is improved from 56 to 91. Next, please. So this is another case with the esophageal cancer with liver mets. It's a quite critical and bad cancer. Next, please. Go to the next slide, please. Yeah, you can see here minimally enhancing circumferential wall. This is the upper and thoracic esophagus. Next, please. This is 2017. These are the medicines given. Hirak, Dasma, again, Sutendra. Kamya Rasayan, now we have approved this drug as a Prepsa Rasayan. This is an old name. And Arpis Rasayan to protect the heart, because this patient was on chemotherapy. So cardiotoxicity is very important in this particular patient. So Arpis was given. Next, please. And after 4 years, when there was no chemotherapy, with the patient having local and distal recurrence, complete local regression was seen. And on 23, no local recurrence, further regression in hepatic region. So patient is survived for 5 years with initially only chemotherapy, but later exclusively only on Rasayan therapy. Next, please. The FACT-G went up from 43 to 103 after treatment. Next, please. This is again a patient with astrocytoma. WHO is like the glioblastoma kind of patient who was supposed to survive not more than 10 months. Next, please. And which was given this Rasayan therapy, and you can see this is 2017. Encasing lesion. Next line and next slide. This is a baseline. This was the treatment given with Indriya Kalyana, Dasma, etc. Next, please. And Protha Rasayan, which is anti-cancer Rasayan. After 15 months of the treatment, the MRI showed complete regression. Next. And this patient is still continuing exclusively Rasayan therapy, now more than 60 months disease-free survival, which is not seen in glioblastoma multiforme. Next, please. So here is a great thing one should know. This is Dr. Richard Smith, who was the, who used to run the British Medical Journal. What he is saying about cancer is the most romantic way to die. Avoid chemotherapy. It's a very deadly statement he has done publicly. In his typical English context and language, he's saying that this is, I recognize, a romantic view of dying, but it is achievable with love, morphine, that is pain killing, what he is emphasizing on, and whiskey is a way of writing. But it's all our patients are doing with exclusively Rasayan therapy. But stay away. The person who spent his life in oncology was the chief editor of BMJ, saying on BMJ's platform, stay away from over-ambitious oncologists. We have hundreds of cases where patients have been advised to go for this kind of treatment with 20, 30, 40 lakhs of rupees with the commitment that you will recover fully. You will be cured. Very unfortunate in our country from over-ambitious oncologists. And let's stop wasting billions trying to cure cancer, potentially leaving us to die a much more horrible death. Patients in whose destiny Ayurveda is, they can die better. It is always in our own hands how to die. Most of the time, especially when there is a diagnosis of cancer. So anyone who is expecting better quality of death must be aligned with Ayurveda, must be aligned with Rasayan. Otherwise, horrible death is certain. Next, please. So as I started that, don't believe in me, don't believe in us, don't believe in our group. Siddanta nama yasya saha parikshakaihi bahuvidham pariksham hetubhishcha sadhayitva sthapyate nirnayaha. Don't believe in Dr. Bendale, what he's saying. We presented Ayurveda on 100 conferences. 100 conferences, all international, global. We do not count any local conference at all. 100 conferences. 42 publications in global level with the impact factor of 50 plus. We do have patents which nobody else has. That's what how that patents is. We are currently going on clinical studies. 14 clinical studies are done already. And we have collaborations for Ayurveda Oncology. We are the first in the country to start Ayurveda Oncology course in India, first time in Ayurveda, in the history of Ayurveda. With the due respect, with the group of our Rasayu Cancer Clinic staff, all staff, Dr. Poonam, Dr. Priyanka, Dr. Prateek, Dr. Monali, Dr. Snehal, all our even non-medical staff, with the help of all of them, we can achieve all these steps with the great vision of Dr. Avinash and his team, Dr. Aarti, Dr. Sherayu, and Dr. Dhanashri, and rest of our team of Ayurveda Saini, who without them, we couldn't achieve even the smallest step. And we have reached to, by in collaboration with 4 prestigious universities in the world, abroad, including 2 state universities in India. And first time in the world, we have taken Ayurveda and cancer therapy to the top-notch platforms of Western medicine. Never before in the history of Ayurveda and India. Without our all team members, I personally would have not been done even 0.01% of all this. So whole credit goes to everyone, including the Mossy who cleans up our clinic, and that is what she is so important for us, and that is what the culture of all inclusive by all means, the culture of Rasai Group. Next, please. These are the publications you can see, the 45, 56, 12. These are the publications, and these are all multinational, global platforms. And I was lucky and to work as the global vice president of Multinational Association for Cancer Care, where we added a lot of value how to take the cancer care of elderly patients. I was the global vice president, only one non-allopathic doctor in the history who became the global vice president of geriatric oncology vertical of Multinational Association, which is the association of 70 countries of the world. And this presence is of 100 likewise conferences we have taken. Ayurveda, American Society of Clinical Oncologists, we were there. European Society of Medical Oncologists, we were there. American Association for Cancer Research, we were there. Korean Society of Medical Oncology, we were there. Society of Integrating Oncology, we were there. That likewise, this is the level of evidence and the confidence what we should have in Rasashastriya. Next, please. And why we cannot do is because of this one person who screwed up our mind, the mind of Indians, that we don't believe in ourselves. What he's saying, that I have traveled across the length and breadth of India, and I have not seen one person who is a beggar, who is thief. Such a wealth I have seen in this country, such high moral values, people of such caliber, that I do not think we would ever conquer this country unless we break the country, the very backbone of this nation, which is her spiritual and cultural heritage. Spiritual and cultural heritage, Ayurveda is embedded in this cultural heritage. Therefore, I propose that we replace her old and ancient education system, including Ayurvedic education system, her culture, for if the Indians think that all that is foreign and English is good and greater than their own, they will lose their self-esteem, their native self-culture, and they will become what we want them, a truly dominated nation. We all are experiencing that is what has happened. I want all of you to join hands together to disprove this man's philosophy and the act of these all people who used to rule on us for 150 years, screwed up our minds. Let's unite together. Let's focus on our culture, our morals, very high morals and value system, and take our science to the next level and serve the society and take our nation to the next level as well. Thank you so much.
Thank you so very much, sir. What an elaborative and extensive explanation. It feels like you are taking Rasayana yourself, you are becoming young, and the enthusiasm you have, the energy you have, it is very in the negative sense, we have this Janapadodvamsa, just like that. It is very communicable, sir. The energy you have is communicable. Even we are feeling that this is how we have to work, and end what you gave, that we have to raise ourselves spiritually and culturally with our system. That was the take home message for all of us. Sir, do you have time for question answer, or shall we forward the questions to you or email to you so that we can get the answers? Because it's already 5:40, so
Sir, you are muted.
sir, you are on mute.
Sorry, very sorry for that. Very sorry. So for a while, unknowingly I touched the button, so I left the meeting. I rejoined. So you can send the questions to anyone who is in touch with you, because I know it's late now and everybody has to rush for the clinic. And thank you everyone for giving me this opportunity to talk and share my experiences with you all. And feel free to send any question to us. We would be happy to help you as much as we can.
Yes, sir. So we'll forward the vote of thanks so that we can wind up.
Yeah, madam, your voice is not audible properly, Archana ma'am. So, vote of thanks by Dr. Vishwanath sir. Are you Vishwanath sir? Yes, sir, please.
Namaste all. It's my privilege. Thank you. First of all, our heartfelt thanks and pranams to Yogesh sir for his taking his time and giving us and just giving a tinge of his voluminous experience and his experience and knowledge. So it's just a tinge for us. I think it's a very huge thing, and I always feel I'm very nascent in the science of Rasashastriya. So there's lot of things, sir. You kept us that many things to be done, and I feel as Ayurveda says, Sattvatma Sharirancha Trayameta Tridandavat. So in this webinar, you are the Atma of the seminar, and there should be Sharira, which we are the Sharira to perceive the things, the inputs given to us. And definitely we will take that and with all blessings and grace of Dhanvantri, it's a way forward for us to work along and go ahead, sir. And lastly, not but not the least, for all the participants over here, as where they are all the recipients. And thank you, sir. Thank you so much. Thank you, everyone. Thank you.
Thank you, Shakuntala ji. Special thanks to you and everyone for being patient.
सर थैंक यू सो मच सर. इतना वापस रसशास्त्र का हम लोगों को प्रयाण मिल गया जो फर्स्ट हमारा रिसर्च से बहुत ही अद्भुत था सर. It was really wonderful, and the part you are told about Rasayana is really excellent, sir. So a new insight how to treat, how to go is a Rasayana therapy. You have given very beautiful concept that, sir. Thank you so much, sir. It is a great learning from you today, sir. Thank you so much.
Thank you, everyone.
Thank you all. Sir, I think sir left the seminar. And thank you so much all the participants.